Access Live. My name is Lada and I shall be hosting. Tonight we are talking to our Access Live veterinarian, Dr. Robert Hendrickson.
Hello.
Welcome to the show.
Same here.
Okay. He is from Manhasset Animal Hospital, and you have been there how many years?
14 years.
14 years, okay. And your specialty, if you have one, is?
Any small animal you can bring in.
Okay, and you were saying pocket animals too.
Pocket pets. Little tiny pets that could fit in your pocket like a gerbil or a hamster.
Okay, and
guinea pigs.
Okay.
School pets.
What is it? School?
Like a school pet.
Okay, sounds good. And exotic animals, right?
And exotic animals. We had a snake last time, right?
That's true. We did. Crawling somewhere in the set. I don't even think we even found him yet. We're still looking for him. In any case, today we are talking about, I don't even want to say the word. What are we talking about today?
You're upsetting me that you don't like cats. I can't believe you don't like these beautiful little kittens. And by the end of the show, I'm going to make sure you kiss a cat.
Oh boy, okay.
I love a cat.
Okay, that's right. I gave a challenge to Dr. Hendrickson and also to you guys out there to give me a reason to love these guys. I mean, they're nice and sweet, but I don't know.
Look at this.
Something about them. Something
about
them that I don't.
You come home from work, a hard day, you have this guy sit in your lap.
Yeah, but he sheds everywhere. That's my problem.
Then, we have some products for that.
Which we will talk
Brushing helps, sure.
Okay. We have a lot of different brands here today. A lot of different breeds here today. So this is gonna be a fun, exciting show. We're gonna be talking all about cats. Anything and everything you want to know about cats. This is a call-in show, so give us a call, 829-6126 and 829-6127. So give us a call. And any questions, also, you don't even have to be about cats. Well, no discrimination, right? They can call you about other stuff tonight.
I made the effort to bring cats in, so you should ask cat questions.
So cat questions. Okay, cat questions. Okay, tell me the first thing. Most people, I guess, think that cats are like little dogs.
Yeah, the thing to remember is a lot of people think a cat is like a small dog, and that's pretty far from the truth. There are a lot of problems that you can see with cats, with things that they can ingest, poisons. If a dog had arthritis, you could give a dog aspirin or even Tylenol. A cat, you can't do that with.
I heard that chocolate or Tylenol can kill a cat?
Chocolate can, just like in a dog, can cause their heart to race quite quickly, and you can have heart problems. But the worst thing is aspirin in a cat or Tylenol. You could kill a cat in 3 days.
Really? Okay.
Their liver can't handle that.
Oh my gosh.
Medicine as a dog's liver can.
Okay. Geez, I have a headache. Can someone bring me an aspirin? No, just kidding. I'm joking. Tell me about now. What does one typically feed a cat? What's the norm? I mean, can they like human food? I mean, go kind of do the whole thing.
No, it's really important to feed a cat a balanced diet, and it would be really difficult to make your own foods for a cat. Okay. You wouldn't want to feed them just tuna fish or fish every day, which they love, because it wouldn't be completely balanced. They need a high protein diet, and they need some essential amino acids like taurine. Otherwise, they'd go blind. So there's dry foods, canned foods, or there's some great name brand foods out there. I particularly like dry foods because it's cheaper, it's a little better for their teeth, clean their teeth, easy to store, and they're all completely balanced. These foods out here are for specific types of problems that cats may have, medical problems, kidney problems, intestinal problems, and things like that.
Okay, but dry food is better, or is it a combination of
You can feed a cat wet food. Certainly, a lot of cats like wet food more than dry food.
Okay.
It tastes better, but you're paying a little extra for the can and the water and everything else, and it's smellier. I don't really like it. It's not as good for the teeth. It causes more teeth problems.
Okay. So if you can get them to eat dry food, all the better.
Plus, it's great if you go away for the weekend. You just leave out dry food instead of it.
Look, now you guys can see this. There's cat hair flying. There's cat hair flying in the studio. Okay. Now this one that we have actually close up now. What
is Cookie,
this?
A Himalayan.
A Himalayan. Okay. Now what makes him a Himalayan? What's the?
Well, the body shape, the long hair.
What is the body shape? Is it different than?
They used to like a longer Himalayan, a longer, leaner look. Now they're getting the breeds are like a squattier look, and he's really got that look. She does, Cookie.
Which is what, squatty? You want to like hold it up so I can just see it?
She's not like a long, slender look like the Siamese there.
Which we have is here.
Yeah.
Oh, he's getting.
The other interesting thing is the markings. And you notice it's darker on the ear tips and the tail and the paws. And what's interesting is the genes that control that are really they're related to the temperature. The colder the temperature, the darker the pigment you'll get. So the ear tips and the tail and the feet will get darker. just like the Siamese you see.
You mean like the
pictures.
extremities?
The extremities. So the gene that controls pigment is controlled by temperature. If you raise these animals, if you had two and you raise them from birth, one in Alaska, let's say one in Florida, the one in the cooler environment would be a little darker than the one down in Florida.
And just on the ear, right, just
the
the
ears,
face,
and maybe a little bit of the body too.
Really? Oh, that's fascinating. Wow. And he has a kind of a squishy face. I mean, that's just the way he is.
Yep. And he's really a mix between a Siamese and a long-haired domestic cat.
Okay. All right. And we actually do have some Siamese over here. Right? No, what is this?
This is Siamese.
Okay, so we're going to close up with this.
And we lost this
we
one's
lost
mate.
one. Do we know where the other one is somewhere?
And Mrs. Davis, we promise we're going to get these two cats back.
Yes, Mrs. Davis, we will find your other cat. It's somewhere here, but we will find it. I guarantee you that. So now you want to get a close up. This is a Siamese. I'm actually going to pick it up, guys.
Yeah,
get this on camera here. I'm picking up the cat. Yeah. Okay, here we go. Oh, he's crying. Okay, now this is Siamese.
Right.
Okay, and that makes him Siamese because why?
He's got shorter hair and the coloring and sleeker body, really skinny.
Right.
And a lot of Siamese, the older cats that we see are usually like skinnier cats. So Siamese, we see a lot of older Siamese over 20.
Okay.
And just because they're nice and thin and skinny.
And that one's not. I mean, under all that hair.
We see cats living longer and longer, but the skinnier body type tends to have a better chance of living longer.
Okay. Now, how old is he?
This guy's either 3 or 4 months old.
Okay. And how do you tell? You could tell if it's a girl or a boy?
Yeah.
I assume. Okay, I believe you.
We have a girl and a boy.
We have a girl. This is the girl.
I didn't look.
Oh, okay. Go ahead. Excuse us while we look. We figure out what kind of animal is this.
This is a female.
This is a female. Okay, it's a female. Okay. And he's good. And then I'm sorry. You said how old?
3 months old.
3 months old. Okay. And he's gonna get bigger than this?
Yeah. He's gonna grow till he's at least 12 months of age.
Okay. He is now. I guess. Oh, you get a close up of this. He's now washing himself, or he was washing.
He's cleaning himself. Interesting thing about the tongue is it works like a little comb. They have bristles on their tongue, and that's because in the wild, cats, tigers, lions, when they get a bone with meat on it, they can lick the bone clear of all the meat with their tongue.
Because the tongue has what?
Little barbules on there, and they can really pull off the meat off the bone. They also use that to comb their hair.
Okay.
And that's why cats are quite clean. They groom themselves, and we hardly ever have to bathe the cat.
Is that something? Because when I was cruising the web and like trying to find out about cats, I mean there were so many, I guess, even jokes about not to bathe it, like stick it in the toilet bowl, flush the toilet bowl a couple of times. Do you have to? I mean, because it's.
Well, I have.
Have you ever had problems?
I have two cats at home that are 17, and I bathe them maybe twice in their lives. Twice. They keep themselves pretty clean.
And they don't smell.
And I probably didn't even have to bathe them those 2 times.
So why did you bathe them?
Just to make them look good. I got them groomed.
Oh, okay.
They're long-haired. Yeah.
Okay, because they're long-haired. But this one you probably would be less smelly and less dirty.
Yeah, usually you don't have to bathe cats unless they had fleas or anything like that.
Okay, which is right. The fleas are more hidden in there. Okay, we have a caller, Jane.
Yes.
Hello.
Hi.
Hello.
Hi. All I want to know is my cats, they go crazy over catnip. What is catnip?
Good question. Catnip is in the mint family, and cats love to lick or smell catnip. And actually, what's interesting is certain cats have the gene that will make them respond to that ingredient. And what's also interesting is cats will not respond until they're after 8 weeks of age, and it's probably about 75% of the cats respond and 25 don't. And they're really not hallucinating like people think. They just smell it and they enjoy it and they roll around, and it's in the mint family. And actually, in people, they make salads and teas and things, but not for hallucinating.
Oh, okay.
Do you know what your cats like it, right?
Yes, they go crazy over it.
When you say what's crazy, what does that mean?
Well, at Christmas time, my girls gave them a toy with catnip in it. And they were ripping it and scratching it, and they didn't know what else to do with it. They were just going crazy.
Okay.
They loved it.
Think of it as Chanel cats.
Chanel for cats. I like that. But there's no harm in them doing that, right?
No, they're not hallucinating or anything like that.
Okay, they're not hallucinating. Okay, and I guess try it in your tea. I don't know. Can they try it in their tea?
Yes, they can.
Now, Jane, can you try it and call us back?
I'll try it. Okay, bye-bye.
Bye-bye. Thank you very much for calling.
Bye-bye.
Thanks a lot. Okay, that's fine. Can you really?
Yeah, you can. They make salads, all different types of things.
And it actually, what does it taste like?
I didn't taste it. Sorry
Oh,
to
you
say.
never tasted it.
I'm not a tea drinker or
Okay,
salad
okay,
eater.
okay. All right. Now tell me, okay, so then, right, you do not have to bathe your cat. How about declawing your cat? Which I think, which
Well, that's
one?
sort of a sore spot for a lot of us as veterinarians. It's something we usually don't like to do because you're really just removing the last piece of bone on their paw, and can be painful. We certainly use painkillers when we do it. It's a surgical procedure. They're in the hospital for 2 or 3 days. But there's other ways out there that can hopefully prevent that. Certainly try scratching posts. Okay. And other deterrents. You can sometimes put balloons or double-sided tape on the sides of couches that they might be ripping, so it might scare them. You can use a squirt gun to scare them. Declawing, it's something we do a lot of. We don't like to do it, but many times we're saving a cat's life in many ways, because if they don't have these claws taken care of, then they're wrecking all this furniture. People are going to get rid of the cat or put the cat to sleep, which would be horrible.
You were saying about what the people do with this thing, the declawing?
Yeah, this is not a...
Oh, that's for cutting nails.
That's for just cutting nails.
Oh, okay. Well, declawing, see, this is how much I know about
Well,
cats.
what's interesting is
I know nothing.
they're under anesthesia, but what some vets do is they use...
So this is for nail clipping.
But there's a similar item called a guillotine clipper.
Okay.
That is sterile.
Okay.
And they actually use that to remove the last bone and suture it up. So that there are vets that use, and it's proper to use a type of nail clipper that's sterile, that they can remove the actual piece of bone and suture it up, and they actually could be a surgical instrument.
Okay, but so you're saying, but that you shouldn't use that.
No, that I brought to show how to clip nails.
Okay, so why would we do that? Can we?
A lot of people buy these again to clip nails, and for cats I don't recommend it. It's good for dogs, but it's so big and bulky, and it gets dull pretty quick. Okay. I just say go out and get a $2 human nail clipper. It's always pretty sharp.
Okay.
And
we're doing this. Okay, why don't we get a close up here?
I can show you. Just press on the nail.
Wait, do we see that?
Press on the toe to get the nail, and always go and stay away from the.
Okay.
Stay away from the quick, which is the red area, and just go in the middle of the curve there like that.
Ah!
Now this guy is great, because I didn't expect him to do this on camera here.
Oh, this is wonderful.
Now whenever I try to do this at home with my cats, forget it.
Really?
Can't do it.
Wow. He's getting a free manicure. Can I be next? Do you polish too? Okay, you're just cutting off the sharp part.
We're just going the middle of the circle, and just staying away from the pink area and just clipping that right in the middle.
Okay, and if
you have a problem, sometimes this guy's great. Sometimes you can wrap him in a towel and just have their paw. What might work is just do one nail at a time, get him used to it, and then give him a treat so he gets used to it.
That was unusual, what just happened, right? Because normally they would be freaking out.
My cat, Poker, she wouldn't
do that. No way. Okay, all right, great. Okay, now talk to me, let's see.
I don't know if we mentioned this is a rag doll.
Oh, this is the rag doll.
Yeah.
Okay. Why?
It's like a rag doll. Look at this guy. He just sort of sits there. He's like inanimate.
He's on catnip. I know he is. I mean, this is the way they always are?
Snickers. Yeah, rag dolls are
and his name is Snickers.
Yeah.
Okay. Meaning he likes chocolate? No, he can't eat chocolate. I learned that, see, right? He can't, no chocolate.
Now look, you're starting to love this guy.
Oh, I'm sorry. Okay. All right, so this is rag doll because of just the way he is.
Well, this is a breed called a rag
the breed,
doll.
Right, yeah. Okay, all right. Let's talk about, what about, you were telling me about fat cats, which a lot of people have.
Fat cats, it's important to know if you have...
Which is Pocahontas. Come over here, Pocahontas.
Hey, that's my cat.
I'm sorry. Okay. If one of you can hand us the fat cat.
We can switch these guys too.
Okay.
If you notice, like a Siamese cat, we usually never have this problem because they're thin.
Right.
But if a Siamese cat was not eating, we'll use this guy.
Okay, here we go. Or this guy?
The guy here,
Not
Jesse.
him? Okay,
this is my cat.
And he's what kind of cat?
This is actually a stray cat, but she's a really good imitation of a snowshoe. See, she's got all white paws there.
Okay.
And she makes the rounds in our hospital. She stays at the hospital, and we take her to the schools. So she's sort of a regular.
Just a regular cat. Okay, Now here we're going to be taking out...
Well, she's called a domestic short-hair.
A domestic short-hair. And now this cat that we're taking out now
This is Jesse.
Oh, he's not that fat, is he?
He's 4 months. He's a little kitten. He's 4 months old.
Oh, okay. Now what is he?
He's a British Shorthair.
A British Shorthair, and they just named them because of what they look like. And
well, the different characteristics. He's sort of stubby. He's sort of got a bulky head.
Okay.
Short-haired, obviously.
Okay.
He's really soft.
Yeah, that's true.
This guy's doing great too. I thought this guy was going to be running all over the place.
Make a good fur coat.
Now. It would be really unfair if I didn't
You missed
mention
that.
Mrs. Henson's name.
Okay.
From
All right.
Manhasset.
Thank you, Mrs. Henson, for your cat.
She wanted her name plastered all over the TV, but we couldn't
Okay.
do that.
Well, we have the placards in the back, right? We'll bring him out in a little while.
So this is the first time I saw Jesse. They just got him. He's a
Okay.
good cat.
Okay, we actually have a caller. Hello, Rudolph? Hello, Rudolph?
Question, yes. Do
Hello?
you hear me?
Hello.
Hello? Here we are.
Yes.
Good evening.
Good evening.
Do you like cats? Wait a second. Do you like cats?
Yes, I do.
Okay.
I have a dog, and a friend of mine has to get rid of a dog, I think, because of the apartment. The cat.
Let's get rid of the cat.
Yeah, he wants to get rid of the cat, and he wanted me to say, I'll give it to you. My problem is, there's a saying, they fight like
Cats
dogs and
and
cats. So the question is that because the dog is older and the cat is older, is it possible they can like each other?
Sure. I would say most of the time, 80% of the time, it'll work things out. What you'd want to do is bring that cat home in a carrier. You can keep that cat away from the dog, but where he can hear it and see it. You can put the cat on the other side of a bathroom door, so he hears that cat, smells the cat for maybe a week or two. And that's a good way to just gradually get those two acclimated to each other. And certainly you should be near them when you first introduce them. And probably the cat could do more damage to the dog. Unfortunately, when we do see fights, sometimes we see that cat scratch the dog, sometimes scratch him in the eye. And we've had dogs that lost sight in their eye because of that.
Wow.
But I would say 80% of the time will work out.
Okay.
I would certainly give that a good shot. That you're going to give that cat a good home.
Okay. So the dog is also small?
Yeah, they're small.
Okay.
It's a small dog, it's not a big dog.
Oh, so too small.
Yeah.
So
I'm afraid
Well, you'd have that dog in a leash when they introduce him after a week of being acclimated. But those are things that can be done.
Okay.
It's not
all right.
terribly unusual.
Thank you very much.
Okay,
You're
I
welcome.
hope
Good
you
luck.
try it. And call us back if it, I hope it works out. Good luck. Okay.
We didn't finish the thing on the liver.
Oh, I'm sorry.
If you want
Okay.
to cover that.
Here we go. Talk to me about the liver.
Siamese cats are thin. If they don't eat for a day or two or three,
Right.
we should see them after 2 or 3 days. That's okay. A fat cat, a cat that's overweight, the fat has nowhere to go after a while, so it'll start going into the liver. So there's fat in the liver. And if a cat that's fat doesn't eat for 2 days,
Right.
they can go into this syndrome called fatty liver syndrome where their liver shuts down, and that's real serious. So if your fat cat's not eating for 2 days, you should really have your vet look at that cat because it could turn into a serious problem.
Because after 2 days,
Because after 2 days, it can make the liver shut down. You can have a liver failure.
and it would just die.
Well, there's things that we can do to support that and get the cats back and feed them, but you want to catch these things earlier than later.
Okay. All right. So then, if your fat cat's not eating, it's not just not eating. Check it out.
Yeah, it's more important to bring
Okay.
that fat cat in before the skinny cat.
Okay. So not like the Siamese.
Yeah, this
here.
guy's not going to have a fatty
Right.
liver problem.
No fatty liver problem. Okay. We actually have another caller. Jack.
Hello.
Hello.
Hello, doctor. I want to ask you about a cat I have. It's about 7 years old and he's overweight. I've been feeding the cat canned food, and I was told that I should give him dry food. And I'm very concerned. We love our cat.
That's a good question. We're just talking about foods, and a cat that's overweight. You want it. The wet of the can is not as important as what it's made up of. You want to get a dry food that's lower in calories. You can get a canned food that's lower in calories. They have foods like this company, Science Diet, makes Science Diet RD, reducing diet. It's got low calories. It's like 50% less calories than regular food. There's WD, which you see in front there. That's a low calorie food, maybe 30% less calories. And those both come in cans too. So you can feed them a food that's lower in calories. You can feed them dry or wet, whatever your cat likes. You can be told exactly right.
That's the stuff that's for the weight.
Low calorie
Right,
for
low
weight.
calorie.
Right.
Okay.
And also you should put them on a regime of working out. You should get them on a program where you play with them with a string or a feather on the end of a string. Those laser pointers are fun at night. You can shine that on the wall, and the cats go crazy for that. Trying to and work them out for 20 minutes every day, just like yourself. If you're overweight, you'd also, besides food, you'd have to put a exercise program in there.
Right. And how does that sound?
It sounds good.
No, wait. Your cat is overweight.
I have Well, I guess we spoil them a little bit on the diet, and so I'll try a little bit at a time using the dry food.
The dry food. Okay, now how about the exercise thing?
The exercise thing, I like the idea of the laser on the wall, get down to their level and maybe play with them with
Okay.
Yeah,
that
20
sounds
minutes a
really
day.
good. Exercise we forget about.
Okay, how about you?
Myself?
Yeah, you want to go get an exercise? with
Yeah,
the-
I'll start running around the house after my wife.
Exactly, and the two, you run after your wife will run after the cat, and then you'll all lose weight. Right?
That's great advice.
Or put catnip behind your ears.
Yeah.
Or in your tea. It might make you hallucinate, I don't know.
The other important thing to remember is a lot of people think that, oh, I want to get my cat to lose weight, so I'm just going to feed them once a day,
Okay.
which is not great because they'll just engorge in the food in one period of time. They might get sick eating so fast. The best is to feed small amounts more often, so maybe small amounts 3-4 times a day, so you fill them up, and they feel full for the whole day after that morning meal.
Okay. All right, that sound good?
Yes, very good.
Okay, so start exercising.
Thanks very much. I will do that.
Okay, bye-bye. All right, thank you very much. Okay, what about now neutering? Is that something that you recommend? I read that it can extend a cat's life for 2 to 3 years. Is that right?
Spaying or neutering a cat, on average, probably increase their lifespan like 1.5 years.
It does.
And for female cats, every time they come into heat, it increases the chance of breast cancer. So
In cats?
In
Can have
cats.
breast cancer.
Sure. And
Oh,
in
you're
dogs
kidding.
also. And if
my
you can
God.
spay them before they come into heat, you virtually eliminate the chance of breast cancer.
Okay.
And so
then-
we highly recommend spaying them to prevent breast cancer and other tumors.
Okay.
And there's an infection they can get called a pyometra sometimes if they're older.
Right.
So that really adds time to the lifespan.
Okay, and it doesn't
Neutering.
change. It doesn't change their like I know in dogs.
Doesn't
it changes
change
their
their personality. What
right?
happens a lot is they're overfed. As they get older, people tend to overfeed their pets. They put extra weight on. They're sluggish because they have extra weight.
Okay.
It's
all
not
right.
so. It's not really the neutering.
Okay.
The other thing about males is probably 99.9% of the male cats, except for stud cats,
Right.
are neutered
Are neutered.
because they'll start spraying around the house.
Okay.
Um,
Spraying around the house. What can we do? I know we have some interesting things here that can.
I can give you this guy.
Oh, is this like a cat? No, this guy. He's angry.
Yeah.
And his. Oh wow, his
His
hair
ears
is
are-
standing up on end.
His ears are
That's not
back.
good. That's not good. Here we have an angry
That
cat.
guy can go in the cage, and this guy can go.
Okay, so now we have the stuff in case what? Now this is when he starts to pee. in
Well, the
places?
latest thing is from France. It's called Feel-Away.
Okay, you want to get a close up of that? That's very
Pretty,
new, right?
pretty interesting stuff. It works 90% of the time. And what it is this is cat facial pheromones. And what it is, when cats smell this, it makes them feel comfortable. They're used to the environment. And if you spray this on spots that a cat might be spraying,
I mean peeing.
peeing,
Right? Okay.
I can say that on the air.
You can say that. Exactly. Yes.
Well, you spray
Okay.
this where they're peeing, and they'll get the feeling that they'll smell the pheromones,
Okay.
and they'll prevent them from really wanting to spray in that area because they feel comfortable. Usually
Okay.
they're upset; they want to mark their territory. But if they smell this, that prevents them from doing that.
Okay. Now we couldn't. All these cats. We have like 6 cats here. Could not live together in one house.
Well,
Like we
they
just
say
saw. We just
probably-
his
Yeah,
hair
this is
still
what you'd say.
standing on it.
Probably after you get 3 or more cats together, there's a big chance that you're going to have behavior problems.
Okay. And that
Spraying,
means
peeing around the house.
spraying.
Yeah.
Okay. They're solitary animals, not like dogs.
Right, they're not like dogs in a pack. They sort of like to be by themselves, and too much in the way of interaction can really upset them.
Okay. Now feline AIDS. Tell me, is that something that is? I never even heard of it. I mean, is that like human AIDS?
It's a lot like human AIDS. What it is it's a virus that they can pick up from other cats, and it's usually passed from a cat fight, a bite, a scratch, and it's a virus. And what will happen, their immune system will be deficient, and they won't be able to fight off other infections. So a lot of times we'll see cats with mouth infections. We test them, it turns out they have feline AIDS. There's not a vaccine for it.
Okay.
There's not really any preventative treatment. There's not much of a treatment for that out there. They have some antivirals, but nothing's 100%.
I mean, is this a certain death that when a cat gets this?
They'll die from other problems, like some other infection.
Because their immune system. So
Yeah.
like
Just in humans.
Right, and it's not said.
You
It's-
can't
it's just-
pass the people, no.
It's not past
No.
the people. Okay, but
Just
now
cat to cat.
cat to cat, right?
And it's fairly prevalent. It's out there. So every
Is-
kitten that we see, We test them for that, make sure they don't have that, and then we know we can keep going and vaccinate them, everything else.
Okay. And now, did it just come around when our AIDS came around? You know what I mean?
Yeah,
Was that kind
it
of
was actually probably about the same time, about 15
Okay.
years ago.
That's interesting.
Yeah.
Huh, okay. Which came from humans, or who knows?
And they probably, if there's a blood bank where they save the blood from all these cats, I bet you if they tested it from the 50s, they'd probably find AIDS too.
Okay.
So it's probably been longer.
So it is. Very interesting thing I read about cats, that when they lick liquid, they lick it from the underside of their tongue. Is that true? I read this.
What book are you reading? The same with
This
the
is
toilet.
the internet.
No,
the internet.
they lap it up. They lap it up.
Okay,
like
well,
that.
I'll
They
have to
pull
show
it.
you where I got that, from the underside.
I'd like to see that.
Maybe there's a, okay, anyway, in any case. Okay, and then what's the most common thing that people come to you? What's the problem with cats that you find the questions that they mostly ask?
Well, older cats, unfortunately, the most common things, two things we see is kidney disease and hyperthyroidism in older cats.
Okay.
Kidney disease, you'll see a cat that's drinking more, which is an important point. If you see your cat drinking a lot more than normal, there's probably a problem. Cats usually don't drink a lot. So
Right.
you see that, you should check them, have them checked out for kidney problems, liver problems, some other things.
Okay.
Hyperthyroidism, you'd see a cat that eats a ton but doesn't gain any weight. And they might be howling at night. They might be they might spit up a little more, and that cat should be checked for hyperthyroidism. And there's a treatment for that.
Okay. All right. We do have a caller, Lauren. Hello, Lauren.
Hi, I have a cat that's 10 years old, and
Okay.
she keeps losing whiskers, like growing and losing them on the left side of her face.
I guess there could be a lot of things that can cause that. The most likely thing might be some sort of trauma if it's one side of the face. If you don't see any obvious infection there, any scaling, if he's not having interaction with another cat, those would be the two most likely causes if it's one side of the face. That's something that your vet could take a look at and make sure there's no ringworm or bacterial infection or anything like that.
Oh, okay.
Did something happen to your cat?
No, it just started happening.
Just like what, started falling out?
No fur. The fur's fine. It's just that they grow, and then, her whiskers, the whiskers grow, and then they just fall.
Yeah, you'd want to just check out the hair follicles there and make sure there's no infection there.
Okay. All right. So go to your vet and check that out, okay?
Okay.
Bye.
Thank you.
Thanks.
Okay. Unfortunately, we are advice. You got a couple of seconds here.
I think
Here's
you
some
got
advice.
to kick this cat. Kiss this cat.
No! But wait, first say your advice. First say the advice. What's the advice? You got the advice. Hurry up. Now we lost it.
No.
Hurry up.
Advice for what? I'm sorry.
For cats. And I promise I will kiss it. I promise.
Well, you should get your cats checked out yearly. You know, when they're ready for their vaccines, the most important part of that vaccine visit is not so much the vaccines, which are important, but it's the exam by the veterinarian to make sure everything's doing okay. The heart, the lungs, the eyes, especially the teeth, because we see a lot of teeth problems.
Oh.
Cats older than 3.5 are going to probably have some sort of gum disease.
Okay. All right. I'm kissing the cat, guys. Here we go.